systems. Lesson 1, National Healthcare System. Alright. Any business, organization, or family can be called a system. A system is a group of individual parts that work together to form a unified whole. Systems theory is a way of studying a system as one unit instead of its individual parts. The theory helps to focus on the primary mission or purpose of a system. Systems theory applies to any system in life, such as the way a family operates or the way a hospital provides healthcare services. By examining the system as a whole, it's easier to understand how each part contributes to the overall mission. Additionally, systems theory makes it easier to pinpoint flaws in the system. To understand systems theory, you must be familiar with the following parts or components of the theory. Input is anything that enters a system, object, or effort. Throughput, process that converts input into final product or service. Output is the final product or service provided by a system. Feedback loop is a process of monitoring outputs to determine whether or not the system is working. Controls is anything that pinpoints problems in the system before the output is complete. Environment is a circumstance and condition in which a system exists. And goals are measurable increments that ensure the mission will be achieved. Once the specific components of systems theory are understood, the system can be evaluated. The key to evaluating a system is to determine whether or not it fulfills the mission. This is sometimes called evaluating the big picture. A healthcare system is made of many small systems, including hospitals, doctors' offices, and even health insurance agencies. These systems must be evaluated according to systems theory to ensure that they are successful and efficient. Nearly every industrialized country has a national healthcare system. Some countries have a system of publicly funded healthcare. Other countries use private funding to administer healthcare services. Neither system is entirely right or wrong. However, each country must monitor the system carefully. Changes may be needed to ensure that the maximum number of citizens receive the healthcare they deserve. Public healthcare systems are those that are mainly funded by taxes and Social Security insurance. The advantage of a public healthcare system is that every citizen in the country is guaranteed healthcare regardless of their economic status. A disadvantage is that healthcare is not always comprehensive. This means that not all types of healthcare services will be paid for. The government may decide which services are included and which are not. Another disadvantage of this type of system is that taxes may be higher compared to taxes in countries with private healthcare systems. Countries with public systems include Norway, France, the United Kingdom, and Canada. What kind of system does the US have? Anybody?
Not everyone has it, so I wouldn't know.
So is it public or private?
Private?
Yep. Private healthcare systems are those that are funded mainly by private insurance agencies and out-of-pocket payments. In a private healthcare system, not every citizen is guaranteed healthcare. Private systems promise healthcare only to those who can afford to purchase health insurance. However, most private systems have government-sponsored programs that provide health coverage for the elderly, disabled, and unemployed, but this coverage may be limited. The private system has certain advantages. Taxes in countries with private health systems tend to be lower than healthcare services, because most healthcare services are not funded by taxation. Another advantage is that private insurance agencies often provide comprehensive services. Finally, private systems can stimulate economic growth in a country by providing competition among private insurance agencies. The United States and Switzerland are examples of countries with private healthcare. Mixed systems. Few countries maintain a purely public system or purely private one. Most countries create a mixed system by using various funding sources to cover healthcare expenses. For example, the United States is primarily a private system. Most citizens purchase insurance through private agencies to cover healthcare expenses. However, the government has created programs that are paid for by taxes. On the other hand, Canada is primarily public. Canadians pay taxes into a public healthcare fund. The money is then used to cover medical expenses for every citizen. However, not every type of procedure or treatment is approved for public funding. Therefore, private citizens may have to pay out of pocket for certain types of medical care. According to the World Health Organization, the 3 primary goals of any nation's healthcare system should be to provide quality healthcare to the entire population, to be responsive to citizens' expectations, to ensure financial protection and fair distribution of financing. These goals must be considered when evaluating any national healthcare system. Let's consider the private system of the United States. Does this system meet the goals proposed by the HWO? Does the U.S. private system provide quality healthcare for the entire population? The private system provides quality healthcare to those who can afford it. The system cannot provide for the entire population. Studies show that nearly 50 million Americans do not have medical insurance. Government programs do provide healthcare for many who are uninsured. These programs do not cover everyone. Is the private system responsive to the citizens' expectations? According to WHO, the United States ranked #1 in the world for the most responsive healthcare system. This indicates that the system of private insurance agencies and healthcare providers is working to maintain satisfied customers. Does the private system ensure financial protection and fair distribution of financing? According to WHO, the United States ranks the lowest of all industrialized countries in the area of fair financing. The United States is the only industrialized country in the world that does not have universal healthcare for all citizens. Now let's consider the public system of Canada. Does this system meet the WHO goals? Does the system provide quality healthcare to the entire population? The Canadian healthcare system does provide healthcare for the entire population. However, several studies indicate that the quality of healthcare provided in Canada is not as good as the care provided in a private system. Canadian citizens may have more difficulty seeing a medical specialist in their country than American citizens would have in seeing one in the US. Is the public system responsive to citizens' expectations? According to WHO, Canada ranks 7th in the industrialized world for responsiveness. This rating is fairly high and seems to indicate that the public system can meet the needs of most Canadian citizens. Does the public system ensure financial protection and fair distribution of financing? According to WHO, Canada ranks 17th in the industrialized world for fair financing. This ranking is considerably higher than the United States. In the area of financial distribution, Canada's tax-funded healthcare system seems to provide more coverage than that of the United States private system. Neither the private system nor the public system is perfect. Each system has some high points and some low points, but all systems must be flexible and able to adapt to the changing needs of society. Additionally, healthcare providers within a system must do their part to ensure that every patient receives the best care possible. So, I mean, when I was your guys' age, I didn't know anything about insurance or anything else, but just based on this short lesson, what do you think you guys would prefer? What have you heard about?
Canada.
Yeah? Why do you think?
Even though, I mean, it's free, and even though it might.
Is it free?
What?
Is it free?
For most.
It's not out of pocket.
Not out of
it's the
pocket,
taxes.
it's like taxes. Even though it's not the most, like, high ranking, like in healthcare, at least durable, because like, bills here are like super expensive. Like my mom, she got her bills for a C-section, she was surrogate, and it was thousands of dollars.
Yeah.
So I'd rather go to private than Canada's healthcare. No offense.
But, I mean, healthcare is kind of messed up in a lot of places. But in Canada, let's say you have a job that you make $30 an hour. So because you have to fund the public healthcare, maybe after that taxes are so much higher than the United States, you would maybe make like $20 an hour after they take out the taxes for that. But if you're in the United States, we tax on other things, and you would make like $28 an hour. So your take-home paycheck is going to be a lot lower for this doing the same job that
Is
has the same
Canada
starting.
cheaper?
What?
Is Canada cheaper?
It depends where you live. I'm just like making up these numbers. But to say that you don't pay for it, and then what if you're the type of person that like goes to the doctor for every little thing that's wrong? You're really using the system, and I mean doctors and healthcare providers, they have to be paid, versus someone who only goes when it's really serious. But you and the other guy, you're both taxed at the same rate for these services that you may or may not use. So that's where people come in to say it's not really fair to have a public system like that. But anyway, that's a whole rabbit hole.